Hello and welcome to How Would You Rate Your Pain? We will be exploring life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell. Thank you for listening, and I can't wait to go on this journey with you. Hello and welcome to another episode of How Would You Rate Your Pain, the podcast that explores life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell, a licensed therapist and your host. Today, we will be talking about a condition that affects 190 million women globally, endometriosis. This condition is often referred to as the mist disease, and Yale reports that on average, women have endometriosis for 10 years before they receive a formal diagnosis. I do want to issue a disclaimer that neither myself or our guests today are medical professionals, and we're sharing our understanding of this condition and our own personal experiences with it. So here to talk to us about living with endometriosis is my dear friend, Christy. Christy and I have many things in common. We both love old lady early lunches. It's what we call them. Early bedtimes, checklists and decluttering, reading, walk and talks, but also endometriosis. So before we get into our topic for today, Christy, I'd love for you to introduce yourself to our listeners and tell them a little bit about you.
Tiffany, thank you so much for having me on. I'm really excited to be here. Just a little bit about me. I am a psychology professor, and I have two little boys, a 9-year-old and a 6-year-old. And my
husband are so cute, by
the
way.
Cute. Like, not biased at all.
I need weekly pictures because they are delicious.
They're great. And my husband and I have been married for about 18 years.
Yeah, I love that. So let's talk a little bit about what endometriosis is. So, my understanding of the condition from, what I've been, taught by doctors or, researched myself is that it happens when the lining of the uterus starts to grow outside the uterine wall. And it can spread throughout the abdominal cavity, and these adhesions can attach to organs such as ovaries, bowels, bladder, and they cause bleeding, inflammation, and internal scarring. What did I miss, Christy?
Wow, you got most of it. You got really a lot of it. I think what's so interesting about all of these symptoms and the things that you just discussed is that that's all true, but it presents itself so differently for every individual. Yeah. So, some of us might have one of them or two of them, or even if we have the same one, it shows it differently in our own bodies. Yeah. So I think along with some of that has to do with like the pelvic pain and the cramping that a lot of women have every month with it, vomiting. Sometimes women have pain with intercourse or even IBS. So a lot of those are some of the symptoms that also are in conjunction to the ones you talked about.
Yeah, I think, as women, we all, don't want to be labeled that like hysterical woman or a hypochondriac. And so I think one of the difficulties with this condition is that you can have so many scattered symptoms that you kind of feel like you're crazy because it's like, what's wrong? Everything feels bad, wrong, weird, and am I just being oversensitive or dramatic? And I don't want somebody to tell me that or perceive me that way.
Yeah, exactly. And a lot of it is chalked up to just, that's just how women are.
Yeah.
You just go through that. And that's
PMS
what
sucks.
Yeah. It's just part of normal life. So you just kind of, like when you're experiencing these symptoms, you're like, am I being dramatic? Am I being not as strong as other women because I'm experiencing it in a different way than they are? So there's definitely this kind of mentality of like, just normal. This is what you go through and suck it up and get over it.
Yeah. And I think, one thing you and I have talked about so much is that we just have such an issue with normalizing women's suffering in this country, whether it is related to menstruation or related to, perinatal mental health and other, things that happen. I have so many friends who have some kind of autoimmune but getting diagnosis for like lupus or celiac or all these things, it can be really hard. And then I think too, we're so busy and there is kind of that whole like, welcome to womanhood, it's going to be terrible every single month. And I think that there's a lot of work to be done to kind of, work on that perception, every person deserves to have a good quality of life.
Yeah, absolutely.
I'm going to pause for just a second. I wonder if you need to move just a little bit in front of, there you go. Now you're in line. Okay, great. Okay, so thinking about like your own experience with endometriosis, when did you realize that something was wrong?
So I had always heard the term endometriosis. My mom actually had it. So like I had been familiar with it, but I never personally experienced any of the major symptoms. I mean, I had cramping and I had a lot of like the traditional things that come along before my menstrual cycle, but it was all chalked up to just like, oh, that's just what you experience, you know?
Yeah.
And because I had regular cycles and I never missed any, it wasn't something that was ever something I had to be concerned about. Now, in retrospect, looking back on it, I probably missed some warning signs. I had really never went through a cycle where I didn't have to have some kind of over-the-counter pain medication, at least the first 2 days. But again, I kind of just thought, you know, this is what women do. Like you just go through it and it's tough and you kind of power through. So it really wasn't until my husband and I started trying to start a family and trying to achieve conception that we started kind of realizing, oh, like this is not coming naturally to us as like everyone else does. Or at least what we thought at the time. So it wasn't until we went through all sorts of different fertility testing and things like that after we had been unable to achieve conception that we started looking into, okay, is there something else going on? Is there something else preventing you from being able to get pregnant? So it was actually a process. It took us about 3 years of infertility to be diagnosed with endometriosis.
Yeah, that's so hard. Yeah, because you didn't, like you said, the symptoms are so individual. And so you didn't have maybe like the hallmarks, or you weren't going in specifically for that. So that might not have been what they were looking for.
Right. And even in the initial testing, because like after about a year of trying to achieve conception, that's when they consider you infertile. So they did initial testing for endometriosis. And they did some screenings and they did like a dye test, you know, where they see if there's any blockages on your fallopian tubes. All of the traditional testing for endo never found anything for me. So my doctor, we were diagnosed with unexplained infertility, which is really just doctor talk for we have no idea.
Yeah, that's not helpful. That doesn't really give us like a path.
No. So we had tried all sorts of like fertility treatments and things like that. And when that failed, before we were about to start IVF, we were ready to start IVF because we had done like IUIs and different types of medicine and things like that. My RE, my reproductive endocrinologist, he said, okay, let's just go ahead and do a laparoscopy just in case to see if there's anything internally that we've missed that maybe the tests and the scans and all of the different types of assessments that they had given me before missed. And when they did the laparoscopy, it was only supposed to last about 30 minutes, you know, so Sean's outside, he's waiting for me to come back out, and our RE comes back out and he's like, hey, this is going to take a little longer. And my procedure took about 4 hours. Because during this laparoscopy is when they found out that I had stage 3 endometriosis. And so, you know, with a laparoscopy, what usually happens is if they find those adhesions and they find those blood clots, they go ahead and clear them out, you know. So in the beginning, they were really just kind of trying to do a scan just to kind of see that everything was in place before we started IVF. And then when they took those adhesions and they took those clots, that's when they tested for endometriosis and found out that I had stage 3.
Wow. So that must have been kind of a surprise for you.
It was a surprise, even though my mom had it. And I know that sounds kind of weird, but like with my mom's endometriosis, like she was in a lot of pain. You know, like there was a lot more of the traditional symptoms, you know, that kind of led to that. And the main reason it was a surprise was because I had done all those other assessments, all those other screenings. I had done so many different types of methods to try to figure out ahead of time, did I have endometriosis? Because I knew that it was genetic, you know, within my family. But we never found those. So for 3 years, here we are trying all these different types. Absolutely. So although it was a surprise, I was also kind of like, okay, at least I have an answer now.
It gets a name.
You know, like this makes sense, you know. And with that laparoscopy, it kind of like reset my time frame to get pregnant. So because they clear you out, you know, so kind of like that 12-month mark for infertility starts over at the laparoscopy.
I didn't know that. Okay. That's so interesting. Yeah, so mine was a little bit different. I think that I think it was 15 when I started having issues with my menstrual cycle, where I was having my period every 2 weeks for 2 weeks, which is really hard.
Yeah.
Actually, I think it was 14. And so I went on birth control and, just kind of, I think I was told that our families got weird women issues. And so nobody had a diagnosis of endometriosis.
Okay.
Nobody else in the family that I knew of. I wasn't raised with my biological mother. So nobody else in the family was experiencing what I was experiencing. And so I think there was a sense of, I'm just not maybe managing it as well. And maybe I'm more sensitive to pain, or, something is just weird, but we just keep living.
Yeah.
And I think that there's so
Power
much,
through.
I know. There's so much, I think, stigma and shame about talking about, things that have to do with women's health. Even just talking about the word menstruation, everyone's like, oh my goodness, are we really going to do that? And then there's all those jokes about, men going to the store to buy feminine products, and it's so embarrassing and only real men can do it.
Right.
And there really isn't that associated with a lot of other things that we use on a regular basis. We just proudly go and buy deodorant all the time, and
Exactly.
And so I think that there was very much it was just embarrassing that, something was wrong with me. And I started to have headaches after a while on the medicine, so I had to go off of it. They were worried about blood clots and things like that. And so it wasn't until I was a sophomore in college, and one of my peers had just had a surgery, had a laparoscopy actually, for endometriosis. And I was like, oh, what's that? And she told me, and I said, well, how did you know to go to the doctor and to have that done? She said, well, I was having this kind of pain and these symptoms and this and that and the other thing. And, I was 20 and I was like, well, everybody has that. That's everybody. And she said, no, it's actually not. Yeah. And I was actually living in Chattanooga at the time. And so she talked me into going to have a consultation. And at that time, I was just about to, was I engaged? Yeah, I was actually engaged. And so I thought, okay, if something's wrong, because I did a little research on the condition, I thought, okay, it can affect fertility. If something's wrong, I feel like I need to know beforehand. And if there's something we can fix, great. And if not, I felt like my fiance, now husband, needed to have that information. And so, so I went in and I was so embarrassed about the whole thing. I didn't tell anybody at work what I was getting done. I didn't tell my family, really. I didn't want anyone to go with me. I literally had that friend from college drop me off and drive me home. Nobody was at my apartment, and then I had a friend from work driving me to a shuttle because I decided it was a really great idea to take a trip the next week. But I didn't want anyone to see that I was in bad shape, and so I was just locked down, so secretive. And that was when they found I had, quite a few adhesions. One of my fallopian tubes was pulled down and attached to my uterus. And then I had adhesions in different places in the abdominal cavity. And so they cleaned all that out. And I think it was nice to have just the suffering I had been having legitimized, but then I was also just mortified. I didn't want this to be wrong with me. Yeah. I didn't know anybody else, that was my age, dealing with this. And in true, Tiffany fashion, I told my fiance and I was like, all right, this is what it is. These are the chances it's going to be an issue. And, if you don't want to go ahead with this, I understand. And that was a really hard conversation. And of course he was like, I don't know what you're talking about. We don't even know if it's a problem, know, and you got it all everything's back where it should be. And so, but that was, kind of my process with it. And, so you touched on it a little bit, but what was your process of getting, treatment or medical help for the endo? Or was it, once everything was kind of, cleared out in the surgery, was your focus then on fertility?
Yeah. So, the human body, especially the female body, it's so complex. Yeah, there's so many different factors. So the laparoscopy was step one, right? Trying to kind of get me reset, if you will, to be able to start trying again to conceive. leave. So our fertility doctor, he told us, all right, you have 12 months now, to kind of try again because we've cleared you out. We've hopefully removed anything that was in the way, preventing it. And so that was kind of the first step. Well, we were able to get pregnant 11 months after it.
Okay.
Exactly. 11 months after it. And like a couple weeks after we found out we were having twins. And we were like, oh my goodness, this is awesome. At this point we had waited like 4-something years, we were like, this is our gift for being faithful and everything, we were super excited. And then right around the 12-week mark is when we lost our twins.
Oh, I'm so sorry.
And that was kind of the start now of our loss journey with it, which was also attributed to the endometriosis.
Okay.
So we had kind of solved step 1 as far as being able to get pregnant, but now the endo and also some other kind of things that I had going on was preventing me from being able to sustain a pregnancy.
Okay.
So our RE was like, okay, yes, one loss, obviously very, very hard, but very common still, which is also something some women don't talk about,
I wish we did. I have so many clients that go through it and, we're just not talking about it.
We're not.
And to the point where women aren't telling anybody when they're pregnant because there's no space for those conversations.
Exactly.
Yeah.
And I think part of that has to do with the fact that with a traditional loss, like you have a funeral, you have some kind of like celebration of life, you have a way of getting closure. But like with a pregnancy loss, that's like an unseen loss.
Yeah, absolutely.
So there's no really like event, there's no really way of getting that closure. So a lot of people feel like they have to keep that for themselves. And there's shame and guilt associated with all of that, So once we kind of like realized that, okay, yes, I was still able to get pregnant, we got pregnant again. We had another loss. We got pregnant again where I had an ectopic pregnancy.
Wow.
And that ectopic pregnancy almost killed me because my endometriosis came back and the adhesions now, most ectopic pregnancies, the embryo attaches itself on your fallopian tube,
right,
and then it continues to grow. And at some point, women have burst tubes and things like that. But for mine, because of where my adhesions were with my endo, it actually attaches itself to my ovary. So this embryo was multiplying and growing, and the baby was getting bigger, attached to my ovary.
Wow.
Well, your body's like, that's not supposed to happen. Like
it's so dangerous.
It's so dangerous. Yeah. So like my body started attacking itself.
Okay.
Where I had a lot of internal bleeding. I actually passed out, had to be rushed to the ER.
Oh my goodness.
And at that point, it was, now I was passed out, so I don't remember any of it. But according to Sean, my husband, he was like, that was incredibly scary.
I bet. Oh my goodness.
We had known I was pregnant, but we did not know that it was an ectopic pregnancy.
Right.
And I guess just exactly where that adhesion was, prevented the embryo from going down my fallopian tube and trying to attach itself to the uterus. But you don't often hear about them on the ovaries. That's a little different. So at that kind of point, like we kind of shifted a little bit in our thinking about how we were going to start our family because that was just a very scary process,
bet. Oh, yeah.
So we looked at other options and like all these other things until we kind of found that there was other medication that I could take in order to hopefully prevent those things in the past from happening. Because like 1 pregnancy loss is very common.
Yeah.
2, not as much.
Right.
And 3, pretty rare.
Absolutely.
So
Yeah. And it's so hard.
So hard.
So hard.
So hard. And, not that I think that women are like only conditioned to make babies.
Sure.
But like at the time, I was definitely feeling like I wasn't being a woman, like I wasn't doing what I was genetically engineered to do, which is not true, but that's how I felt,
Yeah.
So it was very emotional and just very challenging time. But we did find out that I also didn't make what they call folic acid. So my body did not break down folic acid. So even though I was taking all the prenatal vitamins, eating well and doing everything, my babies weren't getting that.
Okay.
So that, along with my endometriosis, was interfering with me being able to sustain.
Yeah. Wow.
Yeah.
Wow. But it took so many tests and conversations.
So many tests, so many conversations, you know, genetic testing of like every single mutation, you know. And I used to joke around that like, because I have a couple genetic mutations, not like the cool one, like the superheroes. Okay. You know, just like kind of messed up ones. Yeah. But after we found those out, then my next pregnancy, I was able to take medication that was able to sustain the pregnancy.
Okay.
So it was something that's how I have Xander, my oldest one. So that was really thankful. But even after I was able to have a full pregnancy, I still lost one baby after it because of my endometriosis. And then I had Judah, my 6-year-old, and then we lost one more pregnancy after that one as well. So it still was there, you know, and it was still affecting me, even though we kind of knew and we tried to manage it with medication and treatment, like it was still there.
Absolutely. Yeah. Yeah. I think that like, for me, I think it was really hard to not feel like there was like my body was against me, you know, that like I, you know, was just kind of at war with myself.
Yeah.
We had a hard time getting pregnant too. My husband's 10 years older. And so then when we got married, you know, we weren't going to wait really that long to start trying. And I don't ovulate.
Okay.
And so like ever.
Yeah.
So, I mean, I know I've ovulated twice because I have 2 kids, but we tried and it was really discouraging. So many tears, and just every month was so disappointing and so hard. And I had kind of given up. It's like the stereotypical story where you give up and like, you know, had actively started looking at adoption and then thought I had the flu. And and I don't have regular or I didn't have regular menstrual cycles. So, you know, you never really could count on that either.
Yeah.
And then, you know, we got pregnant with my oldest. But it was really just kind of very isolating. And then I just felt like I couldn't like hold up my end of the bargain, which no one was making me feel that way.
Sure.
But, you know, you enter into this partnership and you want to have a family, and then it's like, man, I just can't do my part of this.
Yeah.
And there's nothing I can do about it. Like it felt very powerless and, you know, out of control.
Yeah.
And
which
so,
for us, like that we're planners.
I know.
And that we like to be in control of things, that doesn't really bode well for us.
So I love formulas. So, so I think we kind of talked about like the hardest part. I think the hardest part for me was just like, you know, feeling like I was letting down, you know, my fiance and then husband, and then, you know, just not being able to plan. And not being able to do anything about it was really hard. How about you, friend?
So I think initially the hardest part for me was just not knowing what was going on because we were diagnosed with unexplained infertility. That was a really frustrating term for me.
I don't like
because
that.
I'm like, give me some reasons, you know, like I can deal with data. I can be able to like figure out the next step. But it was really hard in the beginning not knowing what was going on. And then I think when I finally got diagnosed, it was almost like, what took them so long? You know, like, why did it take 3 years?
This would have been helpful information 3 years ago.
Right. Why are we not doing this procedure earlier? You know, and that's not to my RE's fault because I actually loved him. He was wonderful. He was fabulous.
Well, and it had been kind of ruled out for you.
It had been ruled out for me, you know? But I think had there been more discussion on endometriosis, like as far as what actually is acceptable and not, I really probably should have maybe advocated for myself a little bit more to have that laparoscopy earlier. Because he told me that the amount of endometriosis that I had, I should not have been walking every single day.
Wow.
Because of how much pain I should have been in.
Yeah.
And then I'm thinking like, was I really in that much pain? And then I'm like, I actually really was. But I powered through, you know, this is just what women experience and you kind of just go through it. So I think had I been maybe more knowledgeable on that information and been like, okay, this is not normal pain. Like, this is not okay. You know, having to pop 4 ibuprofens every morning, every couple hours on my first day of my cycle is not normal. And I think I just chalked it up to just being a woman, you know? So I feel like I might have been able to catch it a little bit earlier. So that part was a little frustrating to me because I feel like we wouldn't have had to go through so much heartache, you know, to do that. So, but in retrospect, like, everything kind of happened for a reason, you know. I know that sounds cliche and cheesy, but like to having my boys, you know, and to where we are. And it really did bring Sean and I closer together. And I met this huge, wonderful group of women who were all going through it together, you know, and we were able to provide support for each other. We were able to talk about it. So I do feel like I did gain a lot from it. But in the beginning, it was really the unknown, how long it took.
Yeah, and I think like what comes to mind as you're saying that is that like I do think that we have these secret pockets of women who find each other and give support, you know. And I always kind of wonder, you know, how could the men, you know, find that place as well? Yeah, because you know that's a journey as well, and so maybe an episode for another day. So how would you say now your condition affects your everyday life?
So I think now, because I've had other family members in my life who have also eventually had to have a hysterectomy in their middle adulthood years, it's kind of in the back of my mind, like, okay, is this month worse than the last? You know, like, is it actually causing more problems? Is it this or that? Because I know that I've had either close friends or family members who eventually did have to have hysterectomy because their endo became so much worse in middle adulthood. Now, because I just turned 40 last year, now that's in the back of my mind. You know, is every month like overanalyzing, like, do I actually need to go get assistance for this? Is this normal? Is it not? So that's kind of where I'm at now with it.
Yeah, I think it's like so frustrating because you don't have like a window in there. Like if it's on your arm, you can look at it and monitor it. But inside, it's just so subjective.
Absolutely.
Yeah. And for people like you and I that I think tend to be dismissive of our own like symptoms, you know, that's not always the easiest. I did have a hysterectomy, so mine doesn't like affect my everyday life as much. So what happened was, I guess is it 2 years ago now? I think it's like about 2 years ago now. I was, so after the birth of my first child, it got a lot better. After the birth of my second child, it got a lot worse. And to where I was missing work, I was almost passing out at work. I was having like a lot of pain to where I wouldn't be able to like, you know, like grip or like use my hands, and I would like feel like I was gonna, you know, vomit and almost pass out and everything. And I think it was, you know, back to that whole like, this is so embarrassing. Like you can't, you know, tell your coworker like, oh, it's, you know, my time of the month. And so one day, you know, every month I'm going to, you know, feel like I might die. And you know, I'm a therapist, so I'd just be sitting there, you know, like trying not to sweat and trying to like look normal on the outside. And so I was having issues with like almost passing out driving, and like it was just really getting bad, you know, kind of in my late 30s. So a couple of years ago, this is just like the worst story. The office still thinks it's really funny, but I was in my private practice, and I was getting ready to start. I think it was like going to be that day. And I was sitting with a client, and this was so tragic. So they were like processing the sudden death of a close family relative. And I was sitting there feeling like off, like feeling a little bit weird. And so it was 5 minutes to the end, and I remember it like it was yesterday. And I was like, you know, I think we did good work today. And if you don't mind, we'll end a few minutes early. Next time we'll pick up where we left off. I'm just not feeling well. And I'd never felt the way that I was feeling. It was like really hard to describe. And so I remember she looked at me and she said, are you okay? And I was like, oh, yes, I'm fine. And she said, do you want me to go get someone from the office? Because in my mind, I thought I was sitting up looking very professional, whatever. I probably looked horrible. And but all I remember saying is, no, thank you. And then I woke up. And it was like a movie moment where, you know, those movies where people come to and there's like all these big faces all around. So I woke up, I had passed out, and I was laid out on the floor, and above my face was my client's face, the office manager's face, and another counselor.
Wow.
And I remember closing my eyes and telling myself, like, whatever this is, just take me now, because I don't want to participate in whatever this is. Yeah. But I had a vasovagal episode, from the pain, and just kind of like resets you. It just turns you off, turns you back on again. And so they called an ambulance. I was like wheeled out of my place of employment through the lobby on a gurney. It was so embarrassing. I just like closed my eyes. And then at the ER, talked to the ER doctor, and they did a bunch of tests, and I was anemic, and my body was just under a lot of stress and strain. And he said, you really need to talk to someone about getting a hysterectomy. He's like, this isn't any way to live. It's not a good quality of life. Yeah. And you deserve to be okay. And I think that episode really scared me. Like, I felt really afraid of what my body, like, quote unquote, would do to me. And it felt like it could happen at any time. And I've passed out before, but never like that. And so it took me like a day or two to kind of feel like myself again. Yeah. And I got right into the specialist office. And I think my biggest fear in going was that he'd be like, why are you here? Like, why are you being dramatic about this? But I described what happened, described, the symptoms I've been having. And he said, you're an excellent candidate for this. And I said, do you think I should get a hysterectomy? And he said, I'm not going to tell you what you should do. I could tell you if I was you, I would. Like, it's time. Yeah. It's time. And then I entered into this whole period of being really afraid. I'd had one laparoscopy. I'd had another surgery. I hate surgeries. I don't think anybody loves them, but I just hate that predictable pain that is coming afterwards. And I knew it would be a big surgery. And so I was really scared, and it was so terrifying. I almost canceled it like a million times. But I was able to kind of lean in, and so this is like our favorite thing to talk about.
I love it.
Yeah. So I actually had a hysterectomy party.
It was amazing.
And Christy,
so fun.
You came to that, and it was like my way of just kind of like bringing the people that I trusted like close to me. I think is another way of getting me not to cancel it. Yes. But
we were going to hold you accountable.
Yes, we're going to actually do this. But we had a party, and my sister made like a cake that like looked like a uterus. And it was amazing. Yeah. And then she got these cookies done that had all these little like sayings on them. Let me see. It was like, see you later, ovulator. Yes. And just
and you had uterus balloons.
Just a word to the wise. Yeah. Amazon has a hysterectomy party pack.
Who would have thought?
That I have saved, because I feel like we're all kind of getting to that place in life where we may need that. But yeah, I had the surgery. It was a really long, rough recovery. It was a partial hysterectomy, so I still have my ovaries, but they took my fallopian tube, cervix, and uterus. And definitely was not prepared for the recovery, but I can tell you it's not bad living without your uterus. Yeah. So I think
you would recommend it?
10 out of 10 would do again. Take off more time than I did for work. But so I don't think it affects my life that much every day, except for the fact that, I have a daughter, and I just see some of those endo symptoms, and, kind of pulls on my heart, to know that she potentially is going to walk this road as well. And you just hate handing that down, to somebody else. But you also know that, you can build a good life with it. But that's kind of hard to watch.
Yeah. So, well, and she's going to have you as a resource, should she actually have to be able to do that.
Yeah, I appreciate that. That's a good point. So Christy, what do you think helped you to get to where you are, with how you feel about having your condition?
So I always considered myself like a pretty big extrovert. I always like had a large group of friends or things like that. But during this journey that we went to, especially when we started having like losses, and things like that, I realized that being extroverted wasn't enough. I had to be vulnerable and I had to be open about my disease and about my journey with others, because even being in the psychology field, I've read all the studies about how like vulnerability builds connections, blah, 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 you know, but like that's really hard. Yeah. It's hard to be vulnerable, especially when it comes to something so personal, you know, something that is, for at least for me at the time, was the biggest thing in my life, you know, was trying to start a family, going through all these losses and things like that, feeling all that shame. But one of the things that helped me the most was starting to talk about it, being vulnerable, not necessarily publicly, but like with those in my inner circle, you know, and there was so much healing. There was so much growth, you know, there was so many opportunities for me to build those connections that really fostered growth for myself. And I wish I would have done it a little earlier.
Yeah.
But vulnerability takes bravery, and I wasn't really brave at the time. I was an extrovert, so I thought, I have friends.
Yeah,
you know?
Like, I'm connected.
I'm connected. Yeah. But that's different, you know, than sharing those parts. And that's a struggle that a lot of people have, I think.
I think you're so right. I don't think I actually spoke the word endometriosis to anyone after my first laparoscopy until, I don't know, like my 30s, you know. And I think, you know, I just didn't want anyone to know. I didn't want it to affect my life. I didn't want to have to accommodate it. I didn't want to feel like I had to say no to anything or not, you know, I just, you know, you and I are both like that. Don't tell me what to do, you know? Yeah. And
you didn't want the pity look.
I didn't want the pity look.
Are you okay?
I didn't want someone to think I was weird.
Yeah.
You know, I just didn't want to have it. Yeah. And if I didn't say it, then I might not have it. And so I think that, you know, having this conversation, I think this is like the first time I've actually talked about it in like a public setting. Yeah. And, you know, I think that's so important to share. It just kind of dissolves the shame that we have like towards ourselves. You know, there can be some self-loathing that we have like societally as women. Yeah. When it comes to these things, you know, we think so much of our own, you know, physiological experience is gross. Like you can't, you know, hold yourself with that kind of contempt and be a whole healthy person. Yeah. You know.
Have you seen what the new generation is doing though?
No.
They have like period boxes for the girls for their first period. They're trying to like normalize talking about it. I think it's so cool.
I think it is.
You know, like with chocolate and all sorts of stuff in it. But it's really cool to be able to like finally talk about it.
Well, I think you and I are always talking about how we think that like Gen Z is the best of us. You know, like we're huge fans. Any of you who are listening, we are your biggest fans.
We are.
And we're learning from you. I will never be on the TikToks, but I'm not cool like that. I'm just not coordinated enough or tech savvy enough. So, but yeah, I love that because that's where we find community and we find healing. And, you know, it feels like if we talked about our suffering, it would feel worse, but it's really the opposite, you know? And I think we don't want to burden other people. But what I always tell my clients is, you know, if you share 10% of something with somebody that you trust, it doesn't land as a 10, it lands at like a 5. Yeah. And then they share with you and you both walk away lighter. Yes. And there's a benefit that you get from carrying other people's suffering and knowing, you know, what's going on in their life. It's what knits us together. I remember I was listening to a podcast one time, and it was this author of a book that I love, Lori Gottlieb. She's written Maybe You Should Talk to Someone, and I think she was on Fresh Air or something. I don't remember, but I remember the host asked her, you know, what's that question that you asked your therapist? And she said, oh, you know, I asked him, you know, do you like me? And the host said, you know, do you have any clients that you don't like? And she said, okay, well, I don't have any clients that I dislike, but I do have clients that I don't like. And let me explain. And she explained that, like, if somebody comes and presents themselves like authentically and openly and shares themselves with you, you can know them. And if you can know them, then you can like them. But if you come and just kind of like give like this, you know, cardboard cutout version of yourself, you know, and you present like your highlights, you know, your Instagram version of yourself, then you can't know somebody. And if you can't know them, you can't like them. And so, you know, we walk around in this world with such, you know, they've called loneliness an epidemic. but we're trying to connect with, the laminated,
right.
Profile pic of ourselves, when it's these insecurities and vulnerabilities and points of suffering or challenges or hardships that really kind of show who you are as a person and what's going on in your world. And unless we are letting people into that part, we can't have connection, and you can be lonely with lots of friends.
Oh, absolutely. Loneliness does not mean being alone.
Right.
Right?
Yeah, absolutely.
Yeah. You can be in a group of tons of people and you're still lonely.
Yeah, and I think, if you're listening today and you're feeling lonely, just sit down and ask yourself, who have I told in the last 7 days something that I authentically think or feel? And do I have a space where I can do that with no judgment? Yeah. And if you don't, then that's okay. That's the goal, right? Is to find safe people and anyways, I'm getting way off track. But
you're okay.
But Christy and I could talk for hours. Okay. Yes. So how do you feel like you've grown or changed from having endometriosis?
Yeah. I feel like I'm a lot more resilient than I thought I was in the beginning. Yeah. So I grew up with a pretty good childhood. My husband and I are high school sweethearts. I haven't really had a lot of adversaries, as far as in my life. And I didn't realize how much I could overcome, by having gone through this. And with having endo and going through the infertility and loss and things like that, there's been so much growth, but also so much just challenges, and just really deep emotional and psychological, challenges that I was able to overcome. Mm-hmm. So being on the other side of it, I'm like, wow, I'm pretty resilient. I'm kind of strong, and I'm also brave. So I feel like those are things that I've learned about myself through this journey that have been really beneficial and that have really helped me kind of get a better self-perspective, of who I am.
Yeah, I love that. I think the same for me, I think is, when I got the diagnosis, I was already, 21, and I'd lived my whole life. And it's like, oh man, I have this thing that I've just kept living life in, anyway, this whole time. It hasn't really held me back. And then I think that especially when it got to the place where I needed to have the hysterectomy, I think it made me let people into the, I don't know about embarrassing, but the more difficult parts, the more personal parts of my life. You're letting people talk to you in a doctor's setting about things you do not want to talk about and explain things that you don't want to know about and answer questions that are awkward. And then just having your girls know, that, and I think, making a party out of it really, really helped. The party pack does have the uterus balloons, but it also has a uterus streamer.
It was great.
And it was wonderful. And everything was themed around reproduction. I think we had blood orange juice and, hard-boiled eggs. And I forget what else we had, but it was all.
You're going to have to put some of those pictures in the notes.
Okay, show notes.
So,
look for the pictures.
Please do.
It was so fun. And, but I think it kind of forced me to kind of start having those conversations and to maybe allow that part of me and my experience to be allowed in my life.
Yeah.
Because it kind of had been shoved in a closet, locked in and been you stay here. You don't get to come out and be in the world that we've made for Tiffany.
But isn't that crazy? Because like you said, it affects 190 million women.
Yeah.
That's so many women.
Well, and probably more than that, right? Because some of them are in that 10-year period that's going to take to get diagnosed. Yeah. So this is all happening. It's happening around you, and maybe it's happening with you. And I think the more we talk about it, the more we kind of I don't know. I think we win.
Yeah.
Okay, so if you could go back to your younger self and share a word of wisdom or encouragement, what would it be?
If I could go back to my younger self, I think it would be to be more of an advocate for myself and to be able to ask for help a little bit earlier. Yeah. I've always been a pretty independent person where I'm okay, give me a list. I can get this done, check. And my husband and I had checked off all the things before we wanted to have kids. Yeah. And I don't think I took my health as seriously there. because, we paid off our student loans, we bought a house, we had 2 dogs, we were ready to have kids, and I wish I would have taken my health a little bit more seriously, because we were young when we first started trying to have kids, so I just didn't expect anything to be wrong. But especially with the women reproductive system and things like that, we can take a lot more precautions earlier.
I love that. Yeah, that's so good. I think that I would tell myself, that it's okay to have limitations. Like, it's okay to go home from work when you don't feel good. Yeah. It's okay to take a nap. It's okay to tell somebody that you're not feeling good. It doesn't have to just be only your husband.
Yeah.
And so, yeah, I think that, I don't like accepting limitations.
Yeah.
And which I totally made my recovery from my hysterectomy way harder than it needed to be because of that. I was like, we were prepping for surgery, and I told my husband, I said, okay, I was doing my PhD at the time, and I was like, hey, text my professor and tell him that I'm going to turn my camera off, but I'll be in class tonight. And he's like, give me your phone. And he texts the guy, and he's like, Dr. Pratt, this is Tiffany Bartell's husband. She's in surgery, and she won't be in class tonight. And he's like, oh my goodness, tell her to get better. I had like conference calls planned for that week.
Tiffany.
I had, I recorded this project, video recorded it 10 days later. It turned out fine, but it was like the worst day of my life. I don't even remember the day after the surgery. I lost like a complete day. I bought a dress online. I woke up on Wednesday and was like, what was shipped? By the way,
was it cute?
Yeah, okay. So cute. I regret nothing. Good. Yeah, great purchase. But yeah, I think accepting limitations is a healthy thing to do. Like, we should live at peace with ourselves, not being like a really bad, taskmaster to our own bodies. Okay, so you go first, Christy. What do you hope that listeners walk away with from hearing about this today?
Well, I think kind of thinking a twofold. The first one is like, if you do have symptoms or if you do have any concerns, even if you're young, it's okay to get checked. I love that you actually went and advocated for yourself and asked to get checked. You had symptoms, but you hadn't been diagnosed yet, so that's great. You don't have to wait until you're 3 years into your fertility journey, to be able to get help. So I think that would be one of the ones that I would look into, is like, if you have any concerns and everyone's just chalking it up to just being a female, go to a different doctor, talk to someone else. It may be that you just need someone who's a better listener, and someone who can be there. And I think the other thing is also just like, when you're in the thick of it, when you're in the middle of like this really challenging situation, know that on the other side, you will see growth, even if you don't feel it while you're in the middle of it.
Yeah.
I remember, crying in the bathroom crying on the floor of my bathroom, with like another negative pregnancy test, and thinking like, I'm never going to be on the other end, I'm never going to have kids, or I'm never going to do this or that. And like, looking back on it now, it's such a small part of my life. It doesn't define who I am, but try to picture yourself on the other side. What would you tell your current self crying on the bathroom floor, to be able to overcome it? Because it's temporary. It's not a forever state. It's temporary.
I love that. Yeah, that's really beautiful. So like, it's a double message of like, be gentle and take care of yourself, comfort yourself in the present, and then, hope for the future.
Yeah.
And kind of picture that. I think for me, I'm hoping that, like Christy said, that if you resonate with anything, or you're like, oh, wait a minute, like, I have some of the symptoms myself, advocate, get a provider to have a good conversation with you about it. And shopping for providers is like shopping for shoes, like, find the one that fits you, that you feel really listened to and valued by. And because, your health is the most important thing, and having somebody to care for that is, it's okay if you're a picky chooser, right?
Yeah.
We're real picky about a lot of other things. And then I hope that like having this conversation helps, even in a little way, to kind of denormalize that suffering, women's suffering, And like Christy said, advocate for yourself. Get those answers for pain or illness, whatever you're experiencing. And it is okay to be a woman and to have like unique health challenges. You don't have to hide and live on the outside as though you don't have that. Right. You can be fully a woman and fully whatever else you choose to be in the world. Mm-hmm. That those things can coexist, and they actually can add value and strength. I think that you and I are both really resilient people, and I think that shows up in the work that we do professionally all the time. And so, it's all, there's room for all of it in all of you in your life. So, Christy, I just want to thank you for being here. I'm always looking for excuses for us to chat about things.
I love it.
Thank you for the coffee you brought. I really appreciate that. Yes. But yeah, thank you so much for being here and sharing so much with everybody.
Yeah. Thank you so much for talking about these tough topics, ones that a lot of women really do feel shame, and they don't really want to discuss it. So I think it's really important. I love that you're talking about it.
I love you so much.
I love you too.
So I also want to thank our listeners for joining us on this episode. I know that many of you are listening and resonating with what we've talked about, or maybe you're having a different experience, but the emotions and the difficulty feel familiar. And I just want to encourage you to find spaces where your own story can be held and given the support and love it deserves. Be gentle with yourself, and I'll see you next time. Thanks for listening to How Would You Rate Your Pain? Please subscribe on your favorite listening platform so you never miss an episode. And if this show made you think of someone, please share it with them to help us grow. I'm your host, Dr. Tiffany Bartell. You can find me on Instagram at the_happy_therapist_. This show is not intended as medical advice and should not take the place of therapy or other mental health services. Please consult with your doctor or mental health provider about your own health. You deserve all the support. How Would You Rate Your Pain is co-produced by WaveLength Studios and Chattanooga Podcast Studios and is part of the Podnooga Network. Graphic design provided by Josh Wilhem at JW Creates and music by Michael Crosa. I'm Dr. Tiffany Bartell. Thanks again for listening. We'll see you next time right here on How Would You Rate Your Pain?